Hi, my name is Michael Bozeman. I'm an SPTA at South University, and in today's video I'll be discussing and demonstrating various manual muscle tests as well as demonstrating some measurements of range of motion. I will begin my video with some goniometry measurements. The first measurement I will be showing you is hip internal rotation. I will have my patient in short sitting. I'll place a towel roll under the distal femur. The axis of my goniometer is going to be on the anterior patella. My stationary arm is going to be perpendicular to the floor, and my moving arm is going to be aligned with the tibial crest. I will now instruct the patient to internally rotate her hip. The patient has scored an internal rotation degree of 30 degrees. We will now demonstrate hip external rotation. I will leave the patient in short sitting with the towel roll placed under the distal femur. My axis again will be on the anterior patella. My stationary arm will be perpendicular to the floor. And I will have the patient externally rotate her hip. As best as you can. Okay, don't lift your hips up. The patient has measured hip external rotation of 31 degrees. Next, I will demonstrate goniometry measurement of hip flexion. I will have the patient lie in supine. Will you please lie on your back? The axis of my goniometer is going to be on the greater trochanter. I'll palpate for that. Can you rotate your head a little? Do it again. Back in. Okay, I'm going to be on the greater trochanter. My stationary arm is going to be on the lateral pelvis, or the lateral midline of the body. And my moving arm is going to be placed on the lateral femur. I will now passively flex the patient's hip. Your knee can flex. The patient reports hip flexion of 120 degrees. Next, I will demonstrate hip extension. I will have the patient roll over to prone. Please lay on your stomach. Again, my axis will be placed on the greater trochanter, and my stationary arm will be on the lateral pelvis, and the moving arm will be on the lateral femur. I will passively extend the patient's hip and hold that. The patient records hip extension to 20 degrees. Next, I will be demonstrating goniometry for knee flexion and knee extension. I will have the patient roll back to supine. The axis will be placed on the lateral of the condyle. And my stationary arm will be on the lateral femur. My moving arm will be placed on the lateral fibula. I will now passively flex the patient's knee. The patient records a knee flexion of 115 degrees. I will now ask the patient to fully extend the knee. I'll place a towel roll under the knee. And my axis is going to be placed on the lateral condyle. My stationary arm will be on the lateral femur. And my moving arm will be placed on the lateral fibula. Patient records a hyperextension of 4 degrees. In the next portion of my video, I'll be demonstrating some manual muscle tests. We will begin with all grades 5 out of 5 for the muscles listed. First, I will begin with hip internal rotation, grade 5 of 5. My patient will be in short sitting. My position will be seated to the side. I'm going to place the patient's limb in internal rotation. I'm going to apply resistance to the distal thigh. And my commands to the patient are going to be, don't let me turn the leg inward. The patient has completed the range of motion against maximal resistance, resulting in a grade 5 of 5. Next, I will demonstrate hip external rotation for a grade 5 of 5. The patient will remain in short sitting. I'm going to resist over the medial ankle and the distal thigh. The patient is going to begin an external rotation. And my commands to the patient will be to don't let me turn the leg out. The patient has resisted maximal resistance, resulting in a grade 5 of 5. Next, I will be demonstrating hip flexion. The patient will remain in short sitting. I'm going to resist to the distal thigh and instruct the patient to flex their hip by lifting their leg off the table. The patient has performed a range of motion against maximal resistance, resulting in a grade 5 of 5. Next, I will be demonstrating hip extension for a grade 5 of 5. I'm going to have the patient lie prone with their arms overhead. I'm going to resist to the posterior ankle, and I'm going to palpate at the hamstring tendon. And I'm going to have the patient extend their hip. Lift your leg off the table without bending your knee. Okay. The patient has performed this range of motion against maximal resistance, resulting in a grade 5 of 5. Next, I will demonstrate knee extension. I'm going to have the patient return to short sitting. Place a towel roll under the thigh. And I'm going to stand at the side. I'm going to resist over the distal tibia. And I'm going to simply instruct the patient to straighten their knee. The patient has performed the range of motion against maximal resistance, resulting in a grade 5 of 5 knee extension. Lastly, I will be demonstrating knee flexion for a grade 5 of 5. I will have the patient return to the prone position with feet off the edge of the table. I'm going to resist on the posterior ankle. My hand will be placed on the hamstring tendon. I'm going to instruct the patient to bend their knee. patient has performed the range of motion against maximal resistance, resulting in a grade 5 of 5. Next, I will be demonstrating manual muscle test for a grade 2 of 5 for all of the muscles listed. I'm going to have the patient return to supine. And first off, I will be demonstrating hip internal rotation for a grade 2 of 5. Simply, I'm going to have the patient externally rotate the hip. I'm going to palpate the gluteus minimus. And I'm going to instruct the patient to roll this leg towards the other leg. Roll it back straight. The patient has completed the range of motion for a grade of 2 out of 5. Next, I will be demonstrating hip external rotation for a grade 2 of 5. The patient will remain in supine. I'll stand at the test side. I will have the patient first internally rotate the hip. I will palpate at the gluteus minimus, and I will instruct the patient to roll their leg out, externally rotating. The patient has performed the range of motion, resulting in a grade 2 of 5. Next, I will be demonstrating hip flexion for a grade 2 of 5. I will have the patient lay in side lying position. I will stand behind the patient. I will support the limb and maintaining a neutral trunk. I will have the patient flex the hip by instructing them to bring their knee towards their chest. Okay. Patient has performed this range of motion, resulting in a grade 2 of 5. Next, I will demonstrate hip extension for a grade 2 of 5. For this, the knee will remain straight. I will support the limb and stabilize at the pelvic crest. And I will instruct the patient to extend the hip by saying, bring your leg towards me, keeping your knee straight. This patient has performed this range of motion, resulting in a grade 2 of 5. Next, I will be demonstrating knee extension for a grade 2 of 5. The patient will remain in side lying. I will first bring the test limb up passively, and the knee will begin in the 90-degree flexion. I will support on the thigh and the ankle, and I will simply instruct the patient to extend their knee by saying, straighten your knee. And again, let's do it one more. Again. This patient has completed the range of motion, resulting in a grade 2 of 5. Lastly, I will be demonstrating knee flexion for a grade 2 of 5. The patient will remain in side lying. I will support the test limb up. I will support at the knee and the ankle. And I will simply instruct the patient to perform knee flexion by stating to bend your knee. And again, bend your knee. And the patient has completed this range of motion for a grade 2 of 5. That concludes my video for today, and thank you all for watching.